HealthCare Community Connection is sponsored by UK HealthCare.
And we're happy to be joined by Dr. Jain, a bariatric surgeon with UK HealthCare's Weight Loss Clinic.
Thank you so much for being here.
Good morning, and pleasure to be here.
Yes, when people are considering weight loss options, there's surgery, there's drugs. What are some things that they should consider? And also, is it a one-size-fit-all treatment plan?
I would say certainly not.
Okay.
It's highly individualized, and with the various treatment methods which revolve around a center or a core of dietary and lifestyle change, there's the other options with medications, different weight loss surgery options, each with their own risk and benefit profile. So it's actually extremely important to discuss this with an expert. I would say BMI or body mass index becomes the usual starting point, but the presence of diseases like diabetes, hypertension, high cholesterol, fatty liver disease, these are all important factors to consider. We have excellent resources through our website, which is ukhealthcare.com/weight loss. But again, at the end of the day, talking to an expert is extremely important because it's a very tailored approach.
What are some of the misconceptions, perhaps, people may have when considering weight loss surgery, and how do you deal with those misconceptions?
I would say there's two very common misconceptions. One is that weight loss surgery is major surgery with high risk of complications. Now, it is true that it is major surgery, but unlike the olden days where this was done in an open fashion, these are now done minimally invasively. So it's either laparoscopic or robotic. And when done at a center that has a truly multidisciplinary approach, it's actually very standardized and protocolized to where the safety is now, in recent studies, comparable to some of the more routine operations like gallbladder or hernia operations. So it is very safe. Now, the other misconception I would say is when people think about weight loss surgery, the initial thought is cosmetic surgery. So unlike tummy tucks or just purely cosmetic procedures, this is much, much more. This is surgery on the stomach and the intestinal tract, which is not only changing how food goes in, but it also changes how food is processed, how hormonal balances act, and it also helps in resolution of many other things such as diabetes, high blood pressure, high cholesterol, fatty liver, cancer risk reduction as well. So it's actually much, much more than that.
And then there's the rise of weight loss drugs such as Ozempic. Do those drugs ever complement surgery? Do they go hand in hand? Can you do one or the other?
I would say that's an excellent question. Nowadays, as I said, there's multiple treatment methods available, each with their own risk and benefit profile and their efficacy. Now, in studies, when they've compared these side to side, surgery is still considered the gold standard for both weight loss and resolution of some of these other medical problems. When we talk about just weight loss alone, the medications are mild to modest weight loss where the efficacy is targeted somewhere around the 5 to 15% range, sometimes 20%. Surgery actually is more in the 20 to 40% range in terms of weight loss, and on comparison, it's been shown to be the most effective both in the short and long term, so durable approach. That being said, the concept around weight management is changing. It's being recognized as more of a chronic illness, just like diabetes, hypertension require routine follow-up and ongoing management rather than a one quick fix. This is no different, and all these different methods actually complement each other. So rather than a substitute, that concept is changing where we use each of these interchangeably to actually see what meets the patient goals the best.
Dr. Jain with the UK HealthCare Clinic, Weight Loss Clinic, and it's great to have you in studio. I know a lot of our viewers appreciate hearing what you had to say.
Thank you so much for having me.
We'll be right back with our final half hour of the newscast after the break.